These are the cries of a child on the brink of death. Bones and skin. That's all that's left of my Abu Arar, who's suffering from severe malnutrition. May is 7 years old, but she's so weak she has to be fed through a syringe. Every sip is painful. Her mother says these liquid meals aren't working.
She's been suffering from malnutrition for 4 months now. She used to weigh 19 kilograms and then it started decreasing. There's such a shortage of protein every day. My daughter has been getting worse and worse.
When May's condition began to deteriorate, her weight loss was followed by seizures. Her mother says May had never spent a night in hospital before.
The doctors told me that she isn't suffering from any disease or from any past conditions. They're saying it's all due to malnutrition, and I haven't seen improvement in her situation at all.
Malnutrition has turned May from a lively child who cared for her baby sister into a fragile skeletal girl struggling to survive.
Unfortunately, the occupation is preventing the entry of vital medicines into the Gaza Strip. Potassium chloride is the easiest medication that any doctor can prescribe. We don't even have that. We have babies die because we don't have it. Sometimes supplies come in, but unfortunately, very little. We're shocked that some medication that does get in, we don't even need.
May is one of thousands of children here suffering from malnutrition. And for their suffering to end, Israel needs to allow desperately needed humanitarian aid into Gaza. And until that happens, more and more children will end up in hospitals like this, close to death. Ibrahim Al-Khalili, Jazeera, Gaza City, Palestine.
Liz Allcock is the head of protection and medical aid for Palestinians. She's joining us from Deir al-Balah in central Gaza. Thanks very much indeed for being with us. Now, you were with us about a month ago. Can you describe to us what has changed in that month?
Good morning and thank you for having me. The situation has deteriorated as it has spiraled over the last 22 months. The stark difference really is the number of infants, newborns, young children who we are seeing in medical facilities clinging onto the edge of life as a result of malnutrition. And being born with birth injuries because of pregnant women not getting the supplements and the nutritional support that they need during their pregnancies. So this situation means that the hospitals, the paediatric intensive care units, the neonatal units are now backed up with children with severe life-threatening malnutrition, meaning that the space for new injuries, people who are coming in with serious, life-threatening injuries as a result of bombardment, of shooting, of shelling, of drone attacks. There's no space to treat people. So you have, on the one hand, massive overcrowding in emergency rooms whereby you have people being treated on the floor. In other instances, you will have a child with malnutrition in a bed. You'll have 3 other children on the floor nearby with injuries, and in many cases, a dead body nearby because the morgue is full, and there is just no space to be able to treat people with any kind of safety or dignity. I think this is the situation, certainly in the medical facilities, that has just spiraled to beyond catastrophic levels.
The United Nations is confirming there is now famine in Gaza. There is speculation that it is likely to spread across the rest of the Strip. Israel's foreign ministry, however, has condemned that report as being based on what it calls Hamas lies. I just want to check, how does what you and your teams on the ground are seeing compare to what is in the UN report?
The UN report, which is an independent body of experts, and it's extremely rigorous, so it provides extremely hard evidence. Many of us were expecting this declaration of famine to have come a long time ago because of what we see on the ground, but because of the thoroughness of the evidence base that's required to make this declaration has taken a while. Therefore, it comes as no surprise at all. If anything, it's quite late. But what we see on the ground in terms of the scene that I've just described to you, I mean, it plays out across the entirety of the Gaza Strip on an absolutely daily basis. It's not only, children, small children, the images that you see with the swollen bellies and the skin and bone arms. It's also elderly people who are unable to get access to any kind of food. It's also healthcare staff, aid workers who are fainting on the job because they don't have enough food or sustenance to keep them going. So, I mean, the Israeli ministry can and do say whatever they like. I think the media perhaps should ask them for evidence to the contrary of what is being said by every national and local aid agency and the UN panel of experts on this matter.
Yes, if I understand it correctly, the Israeli government hasn't yet supplied any evidence to back up the allegations that it has been making. Those questions are being asked. You mentioned about the level of injuries that are coming into the medical facilities in Gaza and the impact that the famine and starvation is having on that. The Israeli military we've been talking about has been intensifying its attacks on Gaza City. Just talk to us what your anticipation of the impact of that is likely to be and what you're seeing.
At the moment, it's about 1,000 people per day of those who are being recorded of having shifted from the north to the south, fleeing under a threat of annihilation. Nobody is choosing to be displaced, of course, but are their lives at the anticipation of further bombardment. But keep in mind that while we don't have ground troops in certain areas of Gaza City, there is aerial and sea bombardment constantly, not only in Gaza City, across the entirety of the Gaza Strip, all the time. This isn't let up at all, but the intensity is increasing in Gaza City itself. And we're also seeing that people's belongings, their homes, their tents, any little scrap of land or property that they may have is being destroyed. So when, for example, we treat children with traumatic brain injury from being, having a bullet lodged in the back of their head or in their spine, they are being discharged to nothing and to nowhere. Because of the scale of the injuries that are coming into hospitals, you have to treat people and then you have to discharge them to make room for the next and the next and the next. And so frequently we are able to do what we can, but with the sad and horrific knowledge that a lot of these kids are going to die upon discharge because they're being discharged into the street because the Israelis have destroyed everything that can make kind of meaningful recovery. We're seeing that people are forced now to make an impossible choice, and that is to remain in Gaza in what may remain of their home, or make this decision to flee to such uncertainty into an area of less than 13% of the territory of Gaza, which is already massively overcrowded and that doesn't have the resources to support a vast influx of people. It doesn't have the resources to support the existing population in areas like Deir al-Balah and Khan Yunis, which are supposedly safe, but of course aren't. So you can imagine 100,000 people coming to a place with massive overcrowding, no sanitation services, extremely limited water resources, no electricity, destroyed roads, destroyed infrastructure, no schools, overcrowded hospitals. It's an impossible situation. Many colleagues of mine are saying, I won't move. What am I moving to? This is not a choice anybody should have to make, and it's not really voluntary when you're being forced at gunpoint.
Liz Allcock is from Medical Aid for Palestinians. She's been talking to us from Deir al-Balah. Thank you very much indeed for your time. Thank you.
Don't miss out and get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.